Welcome to another episode of the Your Longevity Blueprint podcast. Today I have a very special guest, Neil Nathan, who's been practicing medicine for over 50 years and has been board certified in family practice and pain management and is a founding diplomat of the American Board of Integrative Holistic Medicine and a founding diplomat of ISEAI. He's written several books, including Healing is Possible, New Hope for Chronic Fatigue, Fibromyalgia, Persistent Pain, and Other Chronic Illnesses, and On Hope and Healing for those who have fallen through the medical cracks. He's hosted an internationally syndicated radio program podcast on Voice America called The Cutting Edge of Health and Wellness Today. He's been working to bring an awareness that mold toxicity is a major contributing factor for patients with chronic illness and lectures internationally on the subject, which led to the publication of his book, Mold and Mycotoxins, Current Evaluation and Treatment, 2016, now updated to 2022. And then to his best-selling book, which I've read, which is amazing, Toxic, Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness, second edition, also just released. Winter of 2021, he saw the publication of Energetic Diagnoses, a discussion of the value of intuition and energetic devices as an aid to both diagnosis and treatment of medical illness. His book, The Sensitive Patient's Healing Guide, was released in 2024, and the second edition of Toxic is just out as of September 2025. So you've been around a long time. You've written a lot. You're very experienced.
Right. So basically, I'm old. I get that. Right.
Old and wise, very wise. So welcome to the show, Dr. Nathan. Such a treat to have you on today.
Great. Thanks for having me.
Well, let's start with the fundamentals. So, kind of tell us, in your opinion, what are some of the hallmark symptoms of mold toxicity? I want to get to Lyme disease too, and kind of how the symptoms can overlap and go together. But let's start with the common mold illness.
Sure. First, I'd like your listening audience to know that mold toxicity is really common. It's not a rare thing. It is now estimated that there are 10 million Americans currently suffering with mold toxicity, and most don't know it. So as I
Yeah.
go over this list of symptoms, try to think about whether you or your loved ones or friends might have those symptoms, because this is something that's being missed and it isn't yet
Yeah.
replaced by conventional medicine. Okay,
Yeah, which is
so,
another question. But yeah, but back to the symptoms of mold. Yeah.
well, basically, the issue is that mold toxins cause a profound systemic inflammation in the body, and any organ system is fair game for that inflammation. So, on a general level, almost everyone with mold toxicity has some degree of fatigue and
Yeah.
some cognitive impairment.
Yeah.
Many people, because some of this inflammation is in the brain, many people will have anxiety, depression, OCD behaviors, mood swings. It affects sensitivities through the limbic system. So anyone who's become sensitive to light, sound,
Mhm.
smells, chemicals, touch, um, food, and EMFs, all of that is, yep, that's mold toxicity almost certainly causing that. And then we have more specific symptoms like pain of every nature, the pain in any part of the body, headaches, neurological symptoms like peripheral neuropathy, symptoms that involve the heart like palpitations, symptoms that involve the lung like asthma-like symptoms of wheezing, shortness of breath, air hunger, and GI symptoms of
Yeah.
every gas, bloating, distension, diarrhea, constipation, abdominal pain, um, bladder symptoms, pelvic pain, pretty much almost
Anything. Okay.
pretty much, because any tissues that can become inflamed are fair game and you can have it. So it's especially true for people who have a lot of these symptoms, in which you'll go to a physician or a healthcare provider and they'll say, well, nobody could have all of those symptoms. That's got to be in your head. And the answer is no, it's not. It's very real. And people are not thinking about something that can inflame the whole body, like mold toxicity. And for that reason, we'll throw in Lyme disease as well,
Yeah, yeah,
which can do the same thing in a very similar manner.
sure. So I don't remember in my training ever hearing about mold. I don't even think I heard about mold allergies. So like, why do you think most conventional doctors, I hear you say they aren't looking for it because it can cause such widespread, issues in multiple organ systems, but I mean, do conventional docs really get any training in this? Or why else do you think it's
No.
just overlooked and missed so commonly?
So A, they get zero
Zero.
training. Mold allergy is well known, has been for decades. But mold toxicity is a fairly new concept, even, even though it's mentioned in the Bible. There's a
Yeah, yeah,
fairly long passage in Leviticus in which it talks about if you can't easily remediate the mold in a home, burn it down.
yeah, yeah, yeah.
So, I mean, this has been known for centuries, but I think there's a whole group of reasons why it is becoming more prominent now, and then a bunch of other reasons why the medical profession hasn't embraced it yet. So the reason it's becoming more prominent is number one, airflow in houses is markedly decreased. 1979, when we had the energy crisis, people began to build houses differently. They insulated them, they made them tight, there was no airflow through the house. And there's always some mold coming into the house. Most of it, by the way, is not toxic. But a few of those species are toxic. If they get into the house and there is water damage, water will make mold grow and then we're off to the races. So another reason is the world that we live in is profoundly toxic. There is now, it's known that there is now 350,000 new chemicals in our environment in the last 70 years. 500 of them have been tested for safety in human beings. So we have now seriously polluted our planet in a way
Yeah,
that's never been polluted. And that means our organs of detoxification, our liver and our kidneys, are stressed in a way
yeah,
that they've never been in humankind. So we're
sure.
dealing with a difficulty in detoxification. So when we are exposed to toxins, we're profoundly more affected by it than ever before in human history. So we have this increase in toxic exposure, overload of our organs that help do it.
Hmm.
And in terms of knowledge, if there's a new medical device or a new drug, there's a huge impetus economically to push it forth. New knowledge, not so much. So the history of medicine, in fact, the history of science, is all new ideas take one or two generations to actually be accepted by the body of people who decide what's acceptable and what's not acceptable. So this is fairly new information. The full concept of mold toxicity as a major issue causing these symptoms didn't really become known until maybe 2003, when Michael Gray and his group started publishing papers associating the exposure to mold with all of these different symptoms. Until then, there were a few scattered papers, but no one was able to clearly make the association. And then Richie Shoemaker in 2005 wrote his groundbreaking book, Mold Warriors, which laid out the biotoxin pathway, how mold did this exactly, and then told us all that this is really a big deal and we have to start looking about it. And since then, we've made a lot of progress. We've learned a lot more about how to diagnose it and
Hmm.
how to treat it. But mostly this is in the field of functional or integrative medicine. It
Right.
hasn't medical school at this particular point.
So I hear you saying that there's not a big impetus because it's not making a lot of money and it takes a lot of time. And at this point, it's really only in our like lens, under our lens as functional medicine providers. So it's just going to take a long time to make it to conventional medicine potentially.
And it's kind of how
Yeah.
it works. I
Yep.
mean,
Yep.
I'm working as hard as I can to bring this information
Yeah.
to,
Thank God for people like you. Yeah. Yeah.
but it's slow.
Yep.
And if you understand the history of medicine and how information gets accepted, then it doesn't make you so frustrated that why are these people not understanding this? Um, because it just takes time. That's just how it is.
Sure. I want to go back to what you kind of just said, the diagnostic process. And before we started recording today, we kind of talked about there are different opinions out there. There's Shoemaker protocol. Andrew Campbell has his own opinion on, best test. I want to hear from you. You're my guest today, so I want to hear what your diagnostic process looks like and how that may be different some of the other available protocols that are out there.
I do get asked that quite a bit. So understand that I started working with Richie Shoemaker in 2005. I actually I had a patient who came into my office and told me, and I had never heard of mold toxicity before this, by the way. And I've been in what we now call integrative medicine for decades,
Yeah,
but
yeah.
we used to call it holistic medicine. Um, and she literally put his book on my desk and said, read it. I said, sure. And I have a stack of books on my desk. I kind of read voraciously. And she said, no, you don't understand. I want you to read it now.
Now.
I'm paying you to read this book now. I said, wow, this is great. If I could get my patients to pay me to read, that's the best job I've ever had. So fortunately, his biotoxin pathway was early on in his book. And I'm reading this and I'm going, wow, this is brilliant. And it explains a lot. So literally, I called his office that day and said, I'd like to come out to Pocomoke, Maryland and study with you. And Richie was a little paranoid back then because his work on Pfisteria in the Chesapeake Bay had not been accepted by colleagues. They actually, even though it was brilliant work and he did an incredible job with it, the Maryland board put him up to be evaluated because he was messing with the economics of the whole Maryland seaboard.
Sure.
He was telling them there's a toxin in the water and wildlife is dying, and nobody wanted to hear that because tourism was their main industry. Anyway,
Sure,
that
sure. Yeah, yeah, yeah.
ending. So Richie's comment on the phone to me was, who are you and why do you want to come study with me? And I said, I've just read your book. It's brilliant. And I just want to spend time with you. And that was enough for me to come out. I spent some time with him in Maryland and we actually became friends. Like to think we're still friends. Um, and so I learned from him his approach. And over the years, I felt that his approach was not as comprehensive as it needed to be. New information came about, and I integrated that, and I didn't feel like Richie did. So, to be specific for
Yeah,
your
yeah,
listener,
yeah.
just the difference here. So, for example, Richie um, recognized early on that cholestyramine was a terrific binder for some mold toxins, and that became his go-to. He also recognized that you could use visual contrast testing to help make the diagnosis. And he also, shortly thereafter, came up with a number of what we call biochemical markers. Some people call them the Shoemaker markers, things
Mhm.
like TGF beta 1, C4A, MMP9, VEGF, VIP, which were biochemical substances that we could measure that would help us make the diagnosis and to
Sure.
some extent follow up.
Hmm.
And so I embraced what Richie did completely. One of the things that he believed for theoretical reasons was that Marcons, which is a bacteria that grows in the nose, would mess with the body's ability to heal. And so I embraced all of it.
Hmm.
Uh, and I began to do what he did. Over time, it felt to me like when I treated Marcons, nothing much happened to anybody. And many of my colleagues were finding the same thing. So I found that Marcons was not a useful thing to measure or treat because over time we realized that Marcons was not a pathogen, which means a bacteria that will cause harm. It's a commensal, which means that it just lives there. And so you can treat it till the cows come home and you're never going to get it to go away because it kind of belongs there. So I found, and many of my colleagues would agree, that measuring and treating Marcons was not helpful.
What if there are other organisms growing up here? Do you see value in treating those?
If we can
Like,
grow them out,
yeah, yeah,
uh,
okay.
the difficulty is that culturing the nose is notoriously inaccurate and always has been. So the reason that ENTs don't do cultures of the sinuses is that the yield for mold or fungus in the sinuses is less than 10%.
I didn't know that.
You almost have to be lucky to find it. So
Sure.
you culture it and you don't get it, it does not mean it's not there. Now, there's some newer tests, brand new, like MicroGenX has a test that
Hmm.
allows us to do PCR testing that can pick it up better than we ever have before. But that's new and not in common usage quite yet.
Sure.
Okay, so as the story evolves here,
Yeah, yeah.
the urine mycotoxin test emerged, and for a variety of reasons, Dr. Shoemaker never embraced it. I know the reasons why he didn't embrace it, but they don't have to do with the accuracy of the test. He questioned the character of the people who built the lab that did that test. And in point of fact, I know those people very well. They are very honorable people. He took exception to that, and so he's never done a urine mycotoxin test and doesn't believe it's valid. In fact, he believes that it is food intake of toxin that causes the numbers there, and the vast majority of others disagree. Exposure to inhaled spores of mycotoxins of fungi, that's where it comes from.
Sure.
Again, we began to part ways. I
Sure.
began to see great value in it. He didn't see any value in it. But when we got the urine mycotoxin test back, it told us much more specifically what was in that person's body. Forgive me, this is not rocket science. If certain mycotoxins are showing up in your urine, it's coming out of your body.
Right.
It's just,
Right.
very straightforward. So I then know from that test which mycotoxins are present in that body. And over the years, we have begun to put together a large body of information about which mycotoxins are bound best by which substances. So if I want to pull that mycotoxin out of the body, there are certain binders that I can use.
Right.
The cholestyramine, that is the
Hmm.
basis makers program, is a great binder for ochratoxin. It does okay on zearalenone, and it doesn't bind anything else.
Hmm.
If people have other common toxins in their body, like aflatoxin, trichothecene, gliotoxin,
It's not going to
cholestyramine
help. Yeah. Yeah.
can help. So we eventually, and by we, I relied largely on the work of Joe Brewer, who's a infectious disease specialist from Kansas City. Back in 2013, Joe wrote a series of papers about this, using this test, how to measure it, and then how to treat it. And I found that his program was much more comprehensive, much more effective. So if I only use the Shoemaker protocol, yes, I help a certain number of people.
Sure.
But if I expanded the protocol to add binders that were specific, another major concept that Shoemaker has believed for a long time is he doesn't believe that mold colonizes. Colonizing means mold grows in the sinus and gut areas, so that's why you can have a patient who is living in a moldy home and they leave the moldy home, and you hope that they're going to get much better after a couple of weeks in Hawaii. Then they come back to their moldy home and they get sick again. Well, that happens to about 1/3 of patients. More of them will leave the home and not get any better at all because the mold is growing in them, making toxins, and it doesn't make any difference where they live. Although, yes, you've got to get out of mold exposure. That's a
Of
big,
course. Yeah. Yeah. Yeah.
that's big. But the concept of colonization is not one that Richie embraces either. So a couple of fairly major conceptual issues, I don't think allows him to treat mold as comprehensively and as effectively as we need to.
Yeah.
Um,
It was a kind, thorough answer. Yes.
okay, if you want to add in Andy Campbell's program,
Yeah. Yep.
then I want to give these guys their due.
Yeah. Yeah.
Richie put mold toxicity on the
On the
map.
map. Yep.
He is a brilliant man, and he has contributed enormously to our ability to help these millions of people who are suffering right now. Andy Campbell was one of the first on the scene. He and Michael Gray did some of the first papers back in 2003. However, he hasn't really changed his program in the 20 plus years since then. Unfortunately, he got hold of a paper that was written about that time, which suggested that ochratoxin, for example, couldn't get into the urine. Now, I actually read that paper, and I think he didn't quite interpret it correctly because in, for the literally thousands of physicians who are doing this work will see that ochratoxin gets into everybody's urine. It's one of the most common things. So,
Common.
for whatever reason, he will say, and he believes he has a paper that proves it, the ochratoxin can't get into the urine. Well, we have tens of thousands of tests done on patients which shows that it does. But because of that, he again doesn't really believe in the urine test. And then
Either. Yep. Yep.
again, he doesn't have the information we need for the precision medicine that's necessary to do this correctly.
Yep.
And his approach is basically using charcoal as his only binder and heavy doses of itraconazole or Sporanox as the major. So again, he will help a number of patients
Mhm.
who meet his criteria, but the whole field of people who are exposed to all kinds of different toxins, not so much. So again, we've been trying to evolve a way
You must
that
evolve. Yes, you must. Yeah.
that we help everyone who has mold toxicity. And it's an expanding field. And I don't claim that the only one who knows how to do this. Um, but I guess I started working with this on the ground floor. And after 20 plus years, I've successfully treated 4,000 or 5,000 people with mold toxicity. And um, it our, what I mean, our opinion, our refers to the fact that I have a mentorship program for over 300 physicians who are learning this and how to do it. And their experience mirrors mine,
Mhm.
meaning when they've done what I've suggested that they do, their patients have gotten well. And so I think that's how to take this information, if you will.
Sure. Just for the listeners, I want to go back and comment on a couple things. Again, I appreciate that answer. But Andrew McCampbell, if I'm saying his name right, Campbell, yeah, believes in more mycotoxin antibody testing, which is different, of course, and that's in the blood than the urine mycotoxin testing. So just if listeners are thinking, wait, which guy is he talking about? That's the kind of theory, kind of the
Right,
testing that he's developed, just so the listeners know.
right. His
Yep.
test is the myco test, and it measures antibodies.
Yep.
Now, that can be helpful to make the diagnosis, but it's
Sure.
not helpful in following the patient along.
Back for that precision medicine, yeah, to treat the patient appropriately. Yeah. Yep.
It's an immune test. It's not actually measuring the toxins. It's measuring how the immune system is looking at the toxins. And we know that there's a very important concept called immune memory, which is the whole concept behind vaccines, which is once the immune system has found a toxin or something that is infectious in its vicinity, it makes antibodies to it. And it keeps making antibodies to it for years afterwards, which is why vaccines work. So again, you can get these antibody tests for mold, but they're going to stay positive for a very long time. So if you're looking at that particular test, you can't really use it to follow the patient. So
Sure. Sure.
can
Yep.
be
Yep.
can be helpful for diagnosis, not particularly helpful for follow-up work. So for
Sure.
follow-up work, we want to know that what's in the urine is gone. And so the goal of that testing is to get
Yep.
a urine test, which is basically negative once we've initiated treatment and the patient has done it long enough.
Yep. Yep. I also want to go back to those biotoxin markers. So I have seen many cases where they are helpful when they actually present as abnormal. But I also have a lot of patients who sound moldy. You know, it's like if it looks like a duck, quacks like a duck, it's probably a duck. So in my practice, if I know someone, I have a high suspicion someone's moldy and they do present that way on urine mycotoxin testing, sometimes the biotoxin markers are just normal. Meaning if I had only done the blood testing, I wouldn't have found that they were full of mold. So can you explain that? Why sometimes the blood testing, the limitations of the blood testing, I guess.
Okay, so I want to make two comments here.
Yeah.
First, mold toxin messes with the body's ability to detoxify. So in really sick patients, they may not have it show up in their urine.
Urine. Yep. Yep.
So sometimes when I know they've been exposed to mold and their symptoms fit, and the test comes back either weakly positive or negative, that's not something to rejoice about. That means that they're so detoxificationally compromised
Yep.
that they
Yep.
can't even get the toxin into their urine.
Sure.
Those patients, yes, we treat them empirically, which is, okay, I'm going to treat you. And what we normally find is the next test, once we've started treatment and we're getting the toxin out of their body and their ability to detoxify improves, now the numbers come up.
Yep.
It's just a comment.
Thank you for, yes. Yep. Putting that in.
Uh, the the biomarkers, the things like TGF-beta 1 and C4a and MMP9 are not specific for mold. Neither is visual contrast. The visual contrast test will be affected by Lyme, mercury toxicity, and probably some other things that we don't even know about yet. So if that's not normal, it tells us you're inflamed. It
Right.
doesn't tell you
That's
what's inflamed.
why. Yeah. Yeah. Yep.
And it will come back to normal long before the mold is completely out of the body. Now, again, I know that Dr. Shoemaker doesn't know that because he doesn't measure the urine testing. So he will decide, okay, your visual contrast has gone from positive to negative, you're cured. However, not yet. And
Sure.
so, from my experience, many of those patients are not really treated long enough to really get the mold out of their body. The same thing is true with these markers. They're not specific. They're not, mold alone doesn't just do it. Lyme will do it, various infections will do it, like chlamydia species, mycoplasma species, some viruses will get those markers to be elevated. So if it's elevated, yep, I know you're inflamed. It has some value. But what exactly is doing the inflaming is not completely clear. And again, those will come back to normal long before the mold is out of their body. So they have value, but they're not anywhere near as specific, in my experience, as the urine mycotoxin testing.
Sure. Let me go back to the colonization. I'm speaking for you. So you're not a huge fan of treating Marcon specifically, but if a patient has colonization, you are a fan in treating that. So,
Absolutely. It must
yes.
be treated. It must be treated or they
Yep.
won't get well.
So what are some of your like favorite biofilm busters or antifungals or how do you, I know this, we can do a whole podcast on that, but what's your short answer to that? Yeah.
I don't have a short answer to anything, as you're probably realizing here. Well, short answers don't do justice to
Sure,
this.
sure.
Forgive me. Um, so first, let me take a step back. In treating mold toxicity, from my perspective, there are three major components to it. The first is you have to get them out of their moldy environment. The one thing that Dr. Shoemaker and I agree about completely is that you can't get well if you stay in a moldy
Mhm.
environment. And so that is the most complicated and difficult part of treatment for everybody.
Do you
There
think that's the reason why some patients don't get better is they just their environment hasn't been completely cleaned up?
Yeah, I would say by far that is the most
Um,
common reason that you can do everything perfectly and you still won't get well. Because you just simply can't get
yeah,
well if you're still
sure,
exposed to it.
sure.
There's no getting around it. It's not something you can negotiate with. Now, there are financial, social, and various reasons why it's hard for some people to
Yeah.
either
Mhm.
mediate or move. I understand it, but it's still, you can't not do that
Right.
because unless you're okay with being sick for the rest of your earthly life, which is, I mean, I'm a doctor. Health is kind of important to me. So I think that that's an important thing to do, but not everyone has the same values. What can I say? Anyway, that's step one.
Yes.
Two is to take the binders that are specific for the toxins we're finding in their urine. And then In my book, Toxic, there's a table in it which we've put together, which it represents the research of dozens of people that we poured through the medical literature to find out what binders work on which toxins. And we now have a table where you can literally look up and go, okay, I've got ochratoxin in my body. What binders work the best for it? And we know that the answer to that is cholestyramine, Welchol,
Charcoal? Yeah.
and charcoal to a lesser extent, and a little bit propylman in the form, it will work as well. So we're slowly getting a library of
Yeah,
binders that will work. So we give the patients the binders that work for every single toxin. So for example, using one single binder is not going to work for the vast majority of people. You need to use multiple binders that affect every single toxin that we see. Pretty straightforward. Once you've done that, in my experience, a small percentage of patients will be healed by that alone, because not everybody colonizes.
sure.
If you've only been recently exposed to mold and you're only dealing with mold toxin, great. Um, then the binders alone will heal some patients. But most of the people that I see have colonized, so that they will get better to a certain extent. But unless we get the mold out of its places that it's colonized, they're still not going to get well. So to answer your question,
Yeah,
the treatment involves taking antifungals and biofilm dissolving agents, because mold and candida um, secrete a thick layer of glop called biofilm around itself that protect it both from your immune system and from the antifungal. And you've kind of got to dissolve that so that what you're giving has a direct access to the mold and candida and can kill it. So typically, if it's colonized in the sinuses, we'll use nasal sprays. There's a number of antifungal nasal sprays that we use, most commonly nystatin, itraconazole, ketoconazole, and amphotericin B. And then we always use with that a biofilm dissolving agent. And my most common agent is BE spray. The B is bacitracin and the E is EDTA. EDTA being one of the most effective biofilm dissolving agents. And there are others. In the gut, same thing applies. So that again, we would use nystatin and diflucan for the candida, which almost always accompanies the mold, and then itraconazole, amphotericin B for the mold, and then I use Interphase Plus or MCBFM1 as my favorite biofilm dissolving agents. So my message to the audience is we know how to do this now. And there's not one right way to do this. But the principles of treatment have to be there, meaning you have to go after this in the right way,
sure.
or you're not going to make progress. And let me segue to another big topic, which is mold toxicity triggers in many of our patients limbic, vagal, and mast cell issues. And so another major reason for people not making progress is if you
Yes.
don't identify limbic, vagal, and mast cell issues and treat them first, they won't be able to respond to what you're giving them. So,
Can we come back to that? Because that I definitely want to go there.
okay. I
Um,
just I just want to make this,
well,
if we're
thank you.
talking about the bigger
Yes,
picture,
yes,
how do
yes.
we go about doing it?
And
It's
why people don't get better. And yes, yes, yeah. Um, so we kind of opened this conversation talking about this our toxic world and how the liver can get pretty congested. Are you a big fan of also supporting the liver? You know, glutathione, milk thistle. Do you recommend antioxidants? Like Jill Chris is big on antioxidants. Do you incorporate those things as well?
to a certain extent in specific patients. So, for example, I adore Jill Krista. She's one of my favorite people. I teach for 4 years in my mentorship program. Jill did it with me, and we combined the naturopathic with the medical approach, which I thought was
Amazing.
a fabulous way for people to learn how to do this so we can combine these different knowledge bases. Um, I'm going to give you a little conceptual issue here. The major problem with mold toxicity, I've already talked about, is it messes with the body's ability to detoxify. So if you want the body to detoxify better, get the mold out. And what I sometimes see is that people will spend months on detoxifying someone first, and they're still toxic because they haven't really gotten going on what's causing this in the first place. So we're all big on root cause. If we're going to get, if we're going to improve the patient's ability to detoxify, do not wait on getting the mold out because that's the issue here. So with that said, yes, supporting the organs of detoxification across the board are very, very helpful. And yes, I do it. So we want to support the liver's ability to function with alpha lipoic acid, milk thistle, any number of other materials. The kidney's ability to detoxify
Yep.
with bioflavonoids. We need to get the skin's ability to detoxify by getting it to sweat, the GI ability by getting the GI tract fixed up, the lymphatics by improving lymphatic flow. All of those help the body to heal faster.
Awesome. Okay. What about kids? So I don't treat kids personally, but I have a lot of my patients who I'm treating for mold, have children. So clearly their children have exposure. How is the approach to kids any different? I mean, generally speaking, are they also receiving the binders just at lesser doses? Is there anything that the audience would need to know from a baby or a child treatment standpoint?
Yeah, kids do get it. If a mother has mold toxicity and doesn't know it, she can give the mold toxicity to her newborn baby. If she's breastfeeding, mold toxins get into breast milk. So they need to know this so that they can treat it. And yes, we treat kids pretty much the same way at lower doses.
So do you literally just do urine mycotoxin testing even on an infant? Collect their
Yes,
urine and see what, okay.
yes, you can.
Okay.
And we do.
Yeah. Yep.
Kids tend to get better much faster than adults. They tend to be able to reboot their ability to detoxify faster than adults. So, yeah, treating kids is fun and easier, actually.
So we spent quite a bit of time on mold, which was wonderful. I want to go back for a moment just to Lyme. If you can mention some of the main symptoms of Lyme and some Lyme co-infections. It's so hard to have a quick answer to any of this, but what I really want to get into with Lyme is also how there are limitations of basic kind of conventional testing for Lyme. Like I have a lot of patients who come in, they've already had the ELISA Western blot, and they say, "No, I don't have Lyme. I've already been tested." Just like how we're explaining, with mold that there are advanced tests that are available, like urine mycotoxin testing. What testing is, I guess, advanced for Lyme to help us better determine if they really do have some of these infections? I know that was a long question, but I think you follow what I'm saying, what I'm asking.
I get interviewed by Scott Forsgren regularly, and Scott asks these long run-on
Yes, yes, yes.
questions. That's his style. And so I can catalog as you're going here.
We'll
So
start
first
with
of all,
Lyme, just some classic symptoms of Lyme.
the classic symptoms of Lyme are almost identical to what I did for mold, with a few exceptions. It tends to have more joint pain and more specific neurological issues for some patients. So optic neuritis, radiculopathies, which is where nerves are particularly inflamed or damaged. We see that much more in Lyme than we do in mold. Um, the the co-infections of Lyme, like Babesia and Bartonella, also are very, very similar, but there's a couple of specific symptoms that would kind of indicate to you that, oh, I need to look for this here because I don't typically see that with mold. So, for example, in Bartonella, the pain in the bottom of the feet is somewhat unique to Bartonella. The stria, the rashes that people get, are unique to Bartonella. Um, but many of the other symptoms are very, very similar. So each entity has a few symptoms. Babesia, for example, air hunger, night sweats, a frontal head pressure is kind of unique to Babesia so that you can begin to tease it apart, that it's helpful to get testing, especially if the testing is accurate. Now, what you're alluding to is over the years, testing has gotten much better, but the original testing that we had available was really totally inadequate. So what the medical profession started doing in the early days was saying, I'm going to do a Lyme antibody test, and I'm only going to do a Western blot, which was known to be more accurate, if that test was positive. Problem was, the antibody test is so inaccurate, it's like flipping a coin. So countless people were told, we're not going to even measure the Western blot because this really totally inadequate test came back negative. Now, the Western blot, it has turned out, was nowhere near as accurate as it needed to be either. One of the biggest reasons for that is the Western blot test is based solely around one species of Lyme, Borrelia burgdorferi, which is the first one that we found. And that's the only thing it measures. Well, 30 years later, there are 36 plus species of Borrelia which cause Lyme that we now know about, and that test won't pick it up. So there are newer tests, which we now call immunoblots. So the good labs don't even do a Western blot anymore because they realized how inaccurate it is. So from my experience, IGeneX is one of the most accurate tests that we have for, and they do an immunoblot for Lyme, Babesia, Bartonella, and they do fish tests, which if you combine them are way more accurate. Still not perfect,
Sure.
but better than we used to have. Again, these are immunological tests. They measure what the immune system is doing. They don't measure, is this bug in the body right now? And there are some newer tests. Bob Mozzaiani's lab, T Labs, is now looking at blood under the microscope with special PCR fluorescent stains so we can literally see, yes, this bug is in your body right now. And so we
Cool.
have newer tests that are really helpful in helping us pinpoint what's in your body, what is it that I need to treat.
Sure. So I actually don't know that I remember your approach to treating Lyme. Are you big on antibiotics or more like antimicrobials like herbs, or what is your
I use both.
both? Yeah.
I have found that herbs alone are rarely effective enough
Enough.
to get
Sure.
rid of it. So, for example, I've worked with Stephen Buhner for many years, Lee Cowden at Nutrimetics. The tinctures from Beyond Balance and Byron White, all very, very helpful. I think they're very good adjuncts, but I usually don't find people getting well unless they're taking antibiotics as a major component of their treatment.
Sure. I want to get to some of these unusually sensitive patients that you see. So you've written extensively about this. So what makes someone such a sensitive patient, and then how does that change your treatment approach?
Well, what it changes in treatment is if you're unusually sensitive, you won't be able to do anything that I talked about until, until you
Yeah.
make them less sensitive.
Yeah.
It's and so these are people who take a tiny dose of antibiotic or an herb or a homeopathic, and they get much worse instantly. It's like their whole body has become so sensitized they can't do what we need them to do to get well. And there are three main components to that sensitization process. For example, mold toxicity will trigger Lyme, Bartonella, will trigger limbic, vagal, and mast cell issues. I call that the trifecta of sensitivity. There are other pieces to it. There are oxalate sensitivity, salicylate sensitivity, structural issues in the body. There's a whole bunch of other things that will add to the sensitization process. But the big piece of it is the limbic system, the vagal system, and mast cell activation come into play. And once it does, that is what has to be treated first.
So let's break those down. So let's go back to, because this is the first time a lot of my listeners are probably hearing about limbic system dysfunction. So what is that and how do we address that?
The limbic system is the part of your brain that is trying to keep you safe. That's its job. And it's trying to keep you safe by scrutinizing the stimuli you're being exposed to, both external and internal stimuli. And it is basically looking at them and going, is that safe? Is that safe? Is that safe? And if it doesn't think you're safe, it's going to get your attention by giving you some symptoms which are not particularly pleasant. It's not trying to make you sick. It's trying to teach you that, hey, wake up. There's something going on here that you're doing that is not, you should not be doing this. Now, the limbic system, by the way, the vagus does the same thing from a different part of the brain, but gives different symptoms. So the symptoms that the limbic system gives are in two main categories, emotion and sensitivity. So if anyone has any sensitivity, it's limbic by definition. That
Okay.
means sensitivity to light, sound, touch, chemicals, smells, food, and EMFs. Any type of sensitivity, that's limbic. If someone has developed or worsened anxiety, depression, panic, hopelessness, despair, OCD behaviors, depersonalization, derealization, mood swings, that's limbic. And most of my patients have something in both categories. So if we don't ask those questions of the people we're seeing from the start, we're going to miss the fact that I need to get their limbic system rebooted first, or they will probably not be able to do what I need to give them to get well. Now, on the vagal side, because it's a package deal, the limbic and vagal systems have the same job, so they work together. On the vagal system, the vagus, first of all, supplies virtually the entire gastrointestinal tract and is responsible for intestinal motility. So constipation, diarrhea, reflux, gas, bloating, distension, abdominal pain usually has a limbic component to it. It also controls the autonomic nervous system. So palpitations, temperature dysregulation, POTS, blood pressure
Mhm.
issues, respiratory issues, that's vagal. So again, those questions need to be asked at the first visit, because if that's a player, the vagus needs to be rebooted. And almost always, the vagus and limbic system have to be rebooted together, because if you have a limbic, vagal, and mast cell hypervigilant state, if you only work on one of them, you're going to stay hypervigilant. You have to work on all three.
Talked a little bit about vagal tone and, kind of rebooting that on the podcast, but we haven't talked about a little bit, we haven't talked, I'm sorry, any about rebooting the limbic system. So how is that done?
Well, there's a number of programs out there that are
Mhm.
great for doing it. The three that we use the most are Annie Hopper's dynamic neural retraining system, Ashok Gupta's amygdala retraining system, and Kathleen King's primal trust.
Mhm.
So they're kind of different. Um, you need to get a feel for the patient and which one they might be able to do or respond to, but they're all excellent for rebooting the limbic system.
Excellent. Okay. Do you want to comment on mast cell quickly also? Because we kind of talked about that trifecta, limbic, vagal, mast cell issues.
Okay, mast cell is also a protective system, again, triggered primarily by mold and Bartonella in terms of what's triggering it in the first place. When the mast cells get activated, they release over 1,000 different biochemical mediators into the body, most of which have an inflammatory component to it. So if the mast cells are getting triggered, we're adding a whole layer of inflammation to an already inflamed system. So we need to bring that down quieted in order to work on it correctly. One of the ways of first obviously knowing that the mast cells are affected, it's not the only one, is if someone has any symptoms that come on immediately after eating, sometimes while they're eating, then that's a mast cell activation, almost by definition. Nothing, allergy, doesn't come on that fast. But mast cell activation will come on very, very quickly. And that will mean things like sweating, palpitations, anxiety, um, fatigue, brain fog, diarrhea, um, anything that comes on immediately after eating tells you that we've probably got a mast cell issue here, and we need to work on it. And again, that's a whole subject of how
Yeah,
we
yeah. Address
mast
that, yeah.
cells, because a single material won't do it. So again, just to help people identify it, if when you have mast cell activation, it fluctuates, often based on fluctuating levels of mold toxin in the body. So one of the common things that my patients will tell me is, I can eat this food one day and I react to it, and the next day I don't react to it at all. That doesn't make any sense because they're thinking food allergy. And if you had food allergy, you'd react the same way every time. But it's not food allergy. It depends on how reactive the mast cells are at the moment that you're swallowing something that's going down your GI tract. And so that's another tip off that this is a mast cell activation issue.
I do want to talk a little bit about a Herxheimer or die-off reaction because I've heard you say multiple times, like, there's no point in suffering, right? If you're going through a mold detoxification program and you feel like absolute crap, like, slow down. There's no benefit to pushing through. But I want listeners to hear from you, like, since you do have these sensitive patients, like how important it is to go slow and kind of if they do feel like they're getting quickly worse, how to approach that.
Well, my type A patients, which is most of my patients, have this attitude, well, I'll put up with this worsening so that I can get through this faster.
Mhm.
And that will not happen. Sorry, that's not the right concept. Because what's happening is if you're taking too much binder, if you're taking too much antifungal, what's happening is you're mobilizing mold toxin faster than they can process it. And you're literally making them more toxic. And getting more toxic is not a recipe for getting well. Can't do it. So um, it's super important that you experience no worsening with treatment and you find doses that your body can comfortably handle. Now, some of those doses may be minuscule, and that's fine.
Mhm.
For example, I've cured some people by taking a quarter of a teaspoon of cholestyramine every 3 days. And those patients are usually telling me, come on, Neil, what's that going to do? That's pathetic. And the answer is, if that's what your body wants, then that's what your body's we're gonna give it, because that is the path for you to heal. If you try to push it, it is not going to work.
Okay.
Now, a herxing from Lyme is the same, but a little bit different,
Okay.
which is a herx by definition means that we're killing bacteria and releasing the toxins from those bacteria faster than that person can process them. Same concept. And when we first started working in Lyme, and I'm going back 30 years here, we used to rejoice with a herx. It would be, yay,
We're doing something. We're killing something off. Yeah.
we're killing these bugs. This is fabulous. We framed it that way. That's a nice positive way to frame it. But over time, we realized that we're not doing anybody any favor by making them more toxic. And that if you scale down the treatment to not create that toxicity, people heal faster and more easily without suffering.
Great. Okay, a couple of final questions here. So this is a podcast on longevity, right? So how does addressing these chronic environmental illnesses, mold, Lyme, even chemical sensitivities relate specifically to longevity and healthy aging?
Well, it goes without saying that if you have any of these conditions, you're not going to live as long and you're going to be sicker more things.
Miserable.
Sorry, but that's kind of obvious. My biggest concern would be for exposure to mold. Not everyone gets symptoms from exposure to mold. So that if you had exposure not only to mold, but to any of the toxic chemicals that are in our environment, and you don't know about it, say glyphosate, for example, then it is going to mess with your chemistry, and you're not only going to be sick, you can't possibly live as long. So it behooves us to measure what we can measure. Unfortunately, the vast majority of these chemicals we're not able to measure yet. but we can measure some. We can measure glyphosate, for example. We can measure mold. There are real-time and Mosaic have tests which will measure some of our environmental chemicals. So you can get an idea of have I been exposed to this and am I carrying this? So that you can then know, well, I've got to put a little effort into detoxification, maybe get a sauna or a foot bath or take things to improve my liver's ability to detoxify, etc. That would be an important strategy for living your best, healthiest life.
When I think of, again, healthy aging, I think, I want to prevent cognitive decline. So can you speak to how mold can lead to cognitive decline if not treated? How
Absolutely.
prevalent that is?
So as I know you know, I work pretty closely with Dale Bredesen, who has done groundbreaking, pioneering work on how to treat cognitive decline. And when we first started working, Dale found that about 60% of his patients had mold toxicity. The longer we've studied it, that's now at 90%.
Wow. Yeah.
So the number one thing someone could do who, if they had cognitive decline is check your mold level, check for Lyme, check for hormonal imbalance, particularly women as they get older need estrogen to get their brain to function better, um, and look for heavy metal toxicity. Those would be the four most common pieces that I see in my patients with
Hmm.
cognitive decline that are treatable.
Yeah.
And
Yep. Yep.
and if you treat it early, if you catch it early, you can completely prevent cognitive decline. If you catch it later, when someone's already in the advanced throes of Alzheimer's, you may be able to make a difference, but it's
It's
already
harder to
too
reverse. Yeah. Yep.
much harder to reverse the longer it goes on. Yes.
Wonderful. All right. Dr. Nathan, tell us where listeners can find you and all of your books.
Well, all my books are on Amazon. That's easy. And my website is pretty simple, neilnathanmd.com.
And what,
And go ahead.
yeah. And tell me what your top longevity tip is. It doesn't have to be one thing, it could be multiple things.
Well, it wasn't going to be one thing. My top longevity tip is take the time to know who you really are, what gives your life meaning and purpose, fall in love, and stay in love.
No one has said that. That's beautiful. Anything else you want to share that you didn't get the opportunity to share today?
No, I've pretty much overloaded y'all.
Well, Dr. Nathan, this conversation was such a gift. I was so excited to be able to interview you today, but a gift not just to me, but also to my listeners who are searching for answers. So, your willingness to dig deeper when others have given up for decades, really, on patience is what true healing looks like. So, thank you for your, I don't even know how many years. Is it 50 years? I don't know. Years of
It's going on
pushing
50, it's going on 55 now.
50 plus years of dedication to this work and for giving so many people hope. So, listeners, be sure to follow Dr. Nathan on Instagram. And are you Ask Dr. Nathan? Is that your Instagram handle? Are you?
Yes.
Okay. And then check out his books again, including Toxic and the Sensitive Patient's Healing Guide. So, links to all these will be in the show notes. But thank you again for coming on the show. This was amazing.
Thanks for having me.